Hi there, my name is Nicole. I'm going to be your nurse today. I just like to start out by doing my initial newborn assessment on your baby here. Is that okay if I go ahead with the assessment? Do I have your consent? Yes, thank you. All right. Okay, so he looks pretty calm and comfortable right now. No distress noted, which is great. I'm going to go ahead and do his vital signs. Okay, so I'm going to listen to his heart, do his apical pulse. So I'm looking at the fourth intercostal space mid-clavicular line. I'm going to count for 60 seconds and get a rate of 120 to 160 beats per minute. Next, I'm going to assess his respirations. So we'll watch his chest rise and listen to his breaths for 60 seconds for a rate of 30 to 60. Next, I'm going to do his temperature. So we're going to do auxiliar in his armpit. So we're just going to insert into his armpit here and hold his arm close to his chest. And we'll get a rate of 36.5 to 37.5. We don't like to do anything in the ear until about 3 years old. Okay, all right, so we'll move on to our head to toe assessment. So his skin is nice and pink. It's warm, dry, and intact. I'm not seeing any trauma, bruising, cuts, anything like that from birth. No jaundice or cyanosis, so no yellowing or blue. You may see some blue tinged periphery, so like his fingers. That's called acrocyanosis, and it's totally normal for the first up to 10 days of life. All right, so to the head, we're gonna look. We have a nice round shape, no molding. He was a cesarean delivery, so there's no cone head here from the vaginal delivery. We have two fontanelles, one at the front of the head here and one at the back. They're nice and soft, not sunken in or bulging, which is great. Lots of hair, silky smooth, which is another good sign. We have two eyes, the eyeballs nice and opening, following, tracking, great. And they are in line with the tops of the ears. We have two ears as well, which is wonderful. Nose is midline in the face, patent nares. And then we have our mouth, which appears nice and pink and moist. I'm gonna put a glove on so I can assess the inside of his mouth. So we have intact palates, the hard and soft palate in there. And he has a nice, good, strong sucking reflex, which we also wanna see, so that's excellent. Yeah. Moving down to his neck, we have good range of motion. The head's nice and central, midline in the body. All right, and moving down to his chest, a nice round-shaped chest, equal, even respirations. We have two symmetrical nipples, which is wonderful. His ribs, no disformities to the clavicles, which can happen sometimes with a vaginal birth. And then same with the ribs, nice and round. Moving down to the belly here, we have a nice juicy whitish colored umbilical cord. It is dry, intact, and clamped. Wonderful. Nice and soft, no hernias or anything. I'm going to listen to my bowel sounds, all four quadrants. And we will start to hear those bowel sounds about up to like an hour after birth. All right, moving down to the genitalia, remove the diaper. So it looks like we do have no edema or discoloration. We have two palpable testes in the scrotum, which is covered in the rugae or the wrinkles that you see there. We have the tip of the penis has the urinary meatus and is not covered by the foreskin. So are you asking about the foreskin? Yeah, so you're not going to want to forcibly retract that. It's going to kind of eventually, as per Alberta Health, retract on its own over the years. And by about 5 years old, it's going to fully retract. Okay? All right, so we have then our extremities. So we have two arms, equal length, colors. We have good range of motion, it looks like, at all of these joints, shoulders, elbows, wrists, fingers. 5 fingers on each side, fingernails, no webbing between. A nice, good, equal grasps, which is excellent. And then down to the legs, the same equal, nice, good range of motions there. We have the good grasp reflexes for the toes and the Babinski reflex if I'm just doing a nice light tap there, and then we see those toes are fanning out. So then I'm gonna just turn him over and we're gonna get to the back. He's holding up his head nicely, which is good trunk strength. And then we're just assessing along the spine here, 2 fingers, no tufts of fur, nice and symmetrical, which is wonderful. And then his bum, we can see nice patent anus, and it's good tone there. Has he had a poop yet? No, that's normal. Can have the meconium kind of within, which is the first poop within the first 24 to 48 hours. Okay, so that is it for my assessment. Get him over, put up his diaper. Would you like some skin to skin time, or would you like to, some skin to skin? Okay, let's bring him over. Good job, little man.